Back to 13 News Now at noon. July is Minority Mental Health Awareness Month, and this weekend, the Portsmouth Department of Behavioral Health Care Services is holding a walk to shed light on the importance of mental health, especially with minority groups. So here to tell us more about it, we have Dr. Jessica Dennis. Dr. Dennis, thank you for being here today.
Yes, thank you for having me.
A really important conversation all year round, but obviously, of course, very important here in July. Why is this walk so important for the community?
So Portsmouth actually has a population of 98,000 individuals. 64,000 of those individuals are of a minority racial group. To be more specific, Portsmouth is over 50% Black or African American descent. And so when we look at the reason that the Awareness Month even started in 2008, it was because we wanted to challenge the way that people understand and discuss mental health as it relates to minorities, because it's very specific, the issues that impact us. And so that's why Portsmouth really wanted to focus on it, because it is the majority of our population.
Now, you mentioned the issues that are specific to minority groups. Why is it such a challenge to get to those mental health programs and services that you need for minority communities? What are the barriers we're talking about here?
So there's some overarching logistical barriers. We're talking about affordability, childcare issues, transportation. But when we get to minorities, a lot of times it's representation. And so there's a lot of times that on movies, you don't really see a lot of people that may look like them. And so they're like, I'm the only person talking about this. I'm the only person feeling like this. Oftentimes we kind of have that image where we kind of tuck people to the side. Oh, that's just Uncle Pete. We don't talk about him. We don't bring it up. And so because of that, nobody talks about it and they suffer in silence. And some other barriers is just lack of representation in their community. And so oftentimes, because nobody's talking about it, people don't realize that those resources are out there for them.
So the big key here is going to be to use your voice, speak up, normalize the conversation. That's how we move past that.
Exactly.
Fantastic. So we're having this walk. Give us the details on when the walk is and what people need to know.
So the walk is going to be this Saturday from 10 to 1. We're actually going to have a block party after, some music after the walk. And so the biggest thing is to get the awareness out there, because there's a lot of misinformation out there where people are going to TikTok and things like that. And so we want to make sure that we're spreading accurate information out there for the community.
Fantastic. And what do people need to know about the services that your department offers?
So we offer services for mental health, substance use, and developmental disability services across the full spectrum. So case management services, even providing transportation to get to your appointments. We're looking at therapy, medication management, substance use prevention, all kinds of things. People can walk in from 9 to 2:30, meet with a therapist and see what our services are, so that way they can get started with a financial agreement. We even have services as low as $5. Fantastic. So yes, we try to look into all of those things.
Increasing that access for sure.
Exactly.
Well, how can people get more information from you?
So our website is portsmouthva.gov. And we're always available. Like I said, our walk-in aspect is right when you come into our building on 1811, so I had to say it out,
right.
1811 King Street in Portsmouth, Virginia, right next to social services. And so we're always available to talk, ask questions, even if it's not for them specifically or a family member.
Oh, that's awesome. So make sure you reach out to the department and attend this walk as well. Get the information that you need. Help your community. Again, this is something that is valuable any day of the week, but certainly during the month of July, we want to spread that awareness for minority mental health. Thank you so much, Dr. Dennis. We appreciate you for being here.
Thank you for having me.
Yes, come back anytime. Let us know what you're doing.
Okay, thank you.
We'll be right back.